Now, it's a question many people with congestion, a mild cough, even a fever have found themselves asking over the last year and a half, right? We've kind of talked about this. Is it a cold? Is it COVID-19?
Yeah, that's the big question. Which of the two is it, right? So the symptoms between the two can be hard to tell apart. And that's really concerning for parents whose children are heading back to school for in-person learning.
Yeah, so joining us now is Dr. Tamara Moyes Osborne, co-founder, CEO, and medical director of Big Apple Urgent Care in Brooklyn. So, Doctor, good morning to you. Good to have you back.
Good morning. Always great to be here with you guys.
Good to see you, yeah.
So let's begin with this, right? A child starts getting sick. It's mild, stuffy, runny nose, right? We're getting into that season. Maybe it's a sore throat. What should parents do? Do you immediately go and get a COVID test?
So the most important thing to do when a parent sees that their child has cold-like symptoms is to basically take them out of school right away. I think that's the first big step. Because in terms of the symptoms that you can have for a common cold versus COVID-19, they're really similar. They're literally almost the same. Really, the only way to know the difference between the two is to get tested. So the first thing to do is to pull the child out of school and then, definitely get tested at that point. So you can call your pediatrician, you can call your urgent care that's nearby. I know at my urgent care in East Flatbush at Big Apple Urgent Care, a lot of the parents are bringing their kids to get tested. So that's really the only way that we're going to know the difference because the symptoms are so similar.
Yeah, so better safe than sorry. Pull them out of school. Talk to your pediatrician, get a COVID test. I have to ask you, though, as a parent with children about to head back to school, I'm a little concerned because we are seeing that children are getting sick, even more so with this Delta variant, and their symptoms have been even more extreme. We're seeing them on ventilators where we hadn't seen that before. Has it gotten worse?
So since the Delta variant came into the picture, the situation is more concerning. When we had the variants of last year, of course, they were dangerous, but the issue with this Delta variant is that it's the most contagious one. It's most likely the most contagious one that we've had of all the variants that have popped up. So that's really what's causing kind of all the panic and the talk. But, there's no need to panic. At this point, Delta is here. So there are some things that can be done to protect the children. I mean, you have children under 12 that actually cannot get vaccinated.
Right.
So of course that's a concern. So, simple measures, just like making sure that they are wearing masks in school, good quality masks. The infectious disease experts, they suggest getting at least maybe the surgical masks that are 2 or 3 plies. You want to give them good masks in school, take them out of school if they're sick, and make sure that everyone's vaccinated around them. Make sure that the school is making sure that the staff is vaccinated or that the daycare staff is vaccinated. So these measures go a long way and can really prevent bad things from happening.
That's tough in some cases, right? Because some places mandate that their staff and teachers be vaccinated, some places do not. And so I guess with that kind of uncertainty as parents send their kiddos back, especially those under 12, are there any specific symptoms, COVID-19 related, that should maybe be an immediate red flag to parents? Now you're saying pull them out if they have anything, but maybe things we wouldn't see associated with a common cold.
That's a tough one, Dan.
Yeah.
Because like I said earlier, the symptoms are almost the same. There are a couple of little things that can help you tell the difference, but still not definitive. For example, the cough that you have in COVID tends to be a drier cough. And then also if your child or anyone loses their sense of smell, especially without a stuffy nose or before they have a stuffy nose, then that's more specific for COVID-19, but it's still really difficult to tell. So main thing is, and I know this is difficult for parents because, I know parents have sent their kids to school with a little sniffle in the past, which was fine then, but we are completely in a different
we can't take the
situation
chance.
now.
Doctor, very quickly,
at this point,
we have to go, but I want to ask you, I'm also reading that earaches can now be associated with COVID. Have you seen that?
I actually have not had patients personally that had earaches that wound up having COVID. However, any of these upper respiratory symptoms, including, stuffy, runny nose, cough, earaches, all these things have to always get checked out. But in terms of the earaches, I haven't necessarily seen a lot of that at this point.
Well, doctor, as always, good to see you. Thank you so much for
Great
joining us.
Great to see you guys, too.
Good to see you. Yeah.
Be safe.
Right back at you. Yeah.